If you're over 70 and your doctor just celebrated getting your blood pressure down to 120 over 80, you need to hear this. Because for older adults, that perfect number may not always be as safe as we've been told. A large study that followed more than 15,000 seniors for about 5 years found something surprising. In older adults, blood pressure that is pushed too low may be linked to a higher risk of serious falls, fainting episodes, kidney problems, and in some cases, even worse overall outcomes. So in the next few minutes, I'm going to show you the blood pressure range that may be associated with the best outcomes in many older adults, why standard targets may need to be adjusted after age 75, and the simple at-home test you can do tonight that could help identify a major fall risk. And this matters, because we're not just talking about numbers on a blood pressure machine. We're talking about whether you feel steady when you stand up, whether you stay independent, whether you avoid the kind of fall that can change a life overnight. Before we go further, leave a comment with just your age. And if you've ever felt dizzy when standing up from a chair or getting out of bed, add the word woozy. You'll understand why that matters in a moment. Now here's what's happening in doctors' offices every day. A 78-year-old goes in for a routine checkup. Blood pressure reads 145 over 86. The doctor looks at the guidelines, sees that systolic pressure is above the recommended target, and decides it needs to come down. A medication is added, then another. A few months later, the numbers look great. 124 over 78. Everyone feels good about it. The chart looks better. The visit seems like a success. But here's the part that often gets missed. That same 78-year-old gets up at 2 a.m. to go to the bathroom. Within seconds, their blood pressure drops sharply. The brain isn't getting enough blood flow. The room spins. They reach for the wall. They miss. And suddenly this is no longer about good blood pressure control. Now it's about a fractured hip, a hospital stay, rehab, loss of independence, and for some people, a decline they never fully recover from. That is why this conversation matters so much. For decades, the message has been simple. Lower blood pressure is always better, and in middle age that's often true. Controlling high blood pressure in your 40s, 50s, and 60s can absolutely reduce the risk of stroke, heart attack, and kidney disease later on. But after about age 75, the picture gets more complicated. Because a 75-year-old cardiovascular system is not just an older version of a 45-year-old one. It behaves differently. It responds differently. And that changes what a healthy blood pressure number may actually look like. Let me explain why. First, arteries become stiffer with age. Think about a brand new garden hose versus one that's been sitting outside in the sun for 20 years. The old one is less flexible. It doesn't expand the same way. Your arteries go through a similar process. As arteries stiffen, the body may need a little more pressure to keep blood flowing effectively to critical organs, especially the brain and kidneys, particularly when you stand up and gravity starts working against you. Second, your baroreceptors become less responsive. Baroreceptors are pressure sensors in your blood vessels. Their job is to detect sudden changes in blood pressure and tell your body to respond fast. When a younger person stands up, these sensors react almost instantly. Heart rate rises slightly. Blood vessels tighten. Pressure stabilizes. But with age, that response can slow down. So if your blood pressure is already being pushed low by medication and then you stand up, your body may not compensate quickly enough. That can lead to a sudden pressure drop called orthostatic hypotension, and that's when dizziness, fainting, and falls become much more likely. Third, medications are processed differently as you age. The kidneys and liver often clear medications more slowly in older adults. That means a dose that seems reasonable on paper may actually hit harder, last longer, and push blood pressure lower than intended. And this is exactly why the same blood pressure target should not automatically apply to everyone. Recent research suggests that for many older adults, the lowest risk range may not be below 120 systolic. In fact, in some studies, older adults with systolic blood pressure in the 130 to 145 range appear to do better than those whose pressure was pushed down into the very low range. Not because high blood pressure is harmless, it isn't, but because too low can also be dangerous, especially in older adults. And that's the part too many people never hear. Let's make this practical. Imagine you're 76 years old. You go to your doctor. Your blood pressure is 142 over 84. Your doctor says, we should really get this lower, ideally closer to 120. So treatment starts. 2 months later, your pressure is 128 over 78. Another adjustment is made. A little lower still. Now you're at 122 over 76. Looks perfect. But then something starts happening. When you stand up from the couch, you feel lightheaded. When you get up from the dinner table, the room tilts for a second. When you get out of bed, you need a moment to steady yourself. And when you mention it, you may hear, "That's normal at your age. Just stand up more slowly." But sometimes that's not just age. Sometimes that's a sign that the pressure is being lowered too aggressively for your body, because what looks excellent while sitting in a clinic chair may be dropping dangerously low the moment you stand up. And this is where one simple test becomes incredibly important. It's called an orthostatic blood pressure test. It takes only a few minutes, it can be done at home, and it may reveal a hidden fall risk that routine office readings completely miss. Here's how to do it. You'll need a home blood pressure monitor. First, lie down flat on a bed or couch and rest for 5 minutes. After those 5 minutes, take your blood pressure while still lying down. Write down both numbers. Then stand up. And as soon as you safely can, take your blood pressure again while standing. Write those numbers down too. Now compare the two readings. If your systolic blood pressure drops by more than 20 points, or your diastolic drops by more than 10 points, that may indicate orthostatic hypotension. That is a red flag. Because even if your seated or lying blood pressure looks great, a large drop when you stand means your brain may not be getting enough blood flow when you're upright, and that can dramatically increase the risk of falls. For example, if your lying blood pressure is 125 over 78, that may look ideal on paper, but if it drops to 98 over 64 when you stand, that is not a harmless change. That is a major shift in circulation, and it's something your doctor needs to know. Now let's talk about target ranges. These are not rigid rules, and they are not a substitute for personalized medical care. But based on current research, many experts agree that blood pressure targets in older adults should be individualized based on age, health status, frailty, symptoms, and fall risk. For adults around 65 to 74 who are active and generally healthy, a systolic range around 130 to 140 may be reasonable in many cases. For adults around 75 to 84, many do well in a slightly higher range, often around 135 to 145. And for adults 85 and older, or those who are frail, a systolic range around 140 to 150 may sometimes be more appropriate, especially if the goal is to preserve balance, prevent falls, and maintain quality of life. That does not mean high blood pressure should be ignored. It means treatment has to be smarter, more personalized, more cautious, more focused on the real person, not just the number. Now, what about the bottom number? Diastolic pressure. That matters too. In older adults, diastolic pressure that goes too low can reduce blood flow to the heart itself, especially during the resting phase between beats. So if that bottom number is consistently very low, especially below 60, that is something worth discussing with your doctor, even if the top number seems fine. And here's something else most people don't realize. Blood pressure changes throughout the day. One reading of 148 over 86 does not mean your pressure is always that high. It may be lower in the morning, higher in the evening, and affected by stress, sleep, pain, dehydration, or even just the anxiety of being in a clinic. That's why home monitoring is so valuable. It gives you a more realistic average. It shows patterns, and it helps reveal whether treatment is actually helping or pushing things too far. You may be wondering, if this matters so much, why don't more people hear about it? Part of the answer is that medicine changes slowly. Guidelines are often based on large trials that take years to complete, years to analyze, and years to influence routine clinical care. And many older guidelines were built around data from younger or healthier populations. So what's appropriate for a 50-year-old is still too often being applied to an 80-year-old. But older adults are different. Their circulation is different, their medication tolerance is different, their priorities are different. At 45, the focus may be long-term prevention. At 85, the priorities may include staying steady, thinking clearly, avoiding hospitalization, and maintaining independence. That requires nuance. Let me give you an example. Two people are both 81 years old. Both have blood pressure readings of 158 over 88. On paper, that looks the same. But in real life, they are completely different. The first person has mild heart failure, chronic kidney disease, arthritis, and already feels unsteady on their feet. The second person is active, independent, plays golf twice a week, and has no history of dizziness or falls. Should both be treated exactly the same way? Of course not. For the first person, aggressive treatment could increase the risk of kidney injury, dizziness, and a dangerous fall. For the second person, treatment may still make sense, but it may need to be gradual, conservative, and closely monitored. Same age, same numbers, different bodies, different risks, different decisions. That's what good medicine looks like. Not treating the chart, treating the person. So what should you do starting today? Here are 5 practical steps. Number 1, if you're over 70 and on blood pressure medication, get a reliable home monitor if you don't already have one. Number 2, measure your blood pressure at the same times each day, ideally morning and evening, for about 2 weeks. Write it down. Number 3, do the orthostatic test I described. Lie down for 5 minutes, measure, stand, and measure again. Number 4, pay attention to symptoms: dizziness, fatigue, brain fog, weakness after standing. Those symptoms matter. Number 5, bring your log and your questions to your next medical appointment. Ask directly, what blood pressure target is appropriate for me given my age, my health conditions, and my fall risk? That question alone can change the entire conversation, because you are not just a number on a screen, and you should not be managed as if you are. Here's the key message I want you to remember. For older adults, especially over 75, blood pressure that is too low can sometimes be just as dangerous as blood pressure that is too high. The goal is not to chase the lowest number possible. The goal is to find the safest range for your body, a range that protects your heart and brain without increasing your risk of dizziness, falls, kidney injury, or loss of independence. That's the sweet spot. And in many older adults, that sweet spot may be somewhere around 130 to 145 systolic, not necessarily below 120. You now know something many people don't. You know that blood pressure care in older adults needs to be individualized. You know what orthostatic hypotension is. You know how to test for it. And you know how to have a more informed conversation with your doctor. That matters, because informed patients make better decisions, they ask better questions, and they often get better care. If this video gave you clarity, comment informed below. And if you know someone over 65 who takes blood pressure medication, share this with them. It could help them ask a question that changes everything. Subscribe if you want more research-based, practical health information explained in plain English, without hype, without confusion, and without one-size-fits-all advice. And remember, this video is for educational purposes only. It is not medical advice. Never stop, start, or change blood pressure medication without speaking to a qualified healthcare professional who knows your full medical history.